Welcome to our presentation on raising awareness of conflict of interest in patient-oriented research. Today you'll hear from myself, Mark Baines, a person with lived experience, co-founder of the Heartlife Foundation and co-lead of this study, as well as principal investigator Dr. Davina Banner, a cardiovascular and rural health researcher and nurse educator from the University of British Columbia. Before we begin, I'd like to gratefully acknowledge that I live and work on the traditional, ancestral, and unceded territories of the Squamish, Musqueam, and Tsleil-Waututh nations. Over to you, Davina, to introduce our team.
Thanks, Mark, and welcome all. Before we get into it, I'd like to take the opportunity to recognise the contributions of all our team members. All of the members you see here have been integral to the work and have contributed their diverse perspectives and expertise. As you can see, our team includes a wide range of researchers, knowledge users, and trainees. We're grateful for each and every one. In addition, we'd like to take the opportunity to recognise our funders. Here we acknowledge the generous support of Michael Smith Health Research BC, who funded this work through a collaboration and convening grant, and more recently through a REACH grant, allowing us to continue to extend our knowledge translation. Our speakers today have no disclosures relevant to this work.
A conflict of interest happens in health research when a research team member's secondary interests, like their own financial gain or the promise of status or prestige, influence their professional interests and come into conflict with ethical duties towards patients, health professionals, and society. Conflicts of interest can exist in many ways, including when researchers partner with industry or private donors or patient advocacy organizations. Conflicts can be financial or non-financial in nature and can have an impact on equity and credibility. Equity because not everyone has the same access to funding and opportunities, and credibility because the contributions of funding can bias what gets studied and how results are interpreted. Conflicts of interest are important because they could result in ethical problems or poorer quality of research.
To examine conflicts of interest in patient-oriented research, we've undertaken a study comprising of 3 phases. The first phase comprises a literature review, and here we seek to understand what is already known about conflict of interest, and in particular, conflict of interest in the context of patient-oriented research. During phase 2, we conducted a tweet chat to engage with the patient-oriented research community. And third, we've engaged in interviews and will engage in a consensus building workshop where we're learning more about conflicts of interest from the perspective of those that are engaged in patient-oriented research. In the first phase of our study, we undertook a scoping review to explore the existing literature on conflict of interest, as well as conflict of interest in the context of patient-oriented research. Our team examined 8 databases and 2 independent researchers screened over 20,000 sources. Despite this initial large volume of literature, we found that few studies explored conflict of interest, and even fewer explored conflict of interest in patient-oriented research or similar forms of engaged research. A total of 61 articles was included in our final review cohort, and we analysed these thematically. Through our review, we learned that there is a lack of consensus around what constitutes a conflict of interest, and even more so, a lack of consistency in the definitions and terminology used to define conflict of interest. We found that there were a lack of policies and guidelines for conflict of interest in research, and in particular, even less in relation to patients and patient groups. Of note, there was increasing recognition of the importance of industry funding and the need to examine conflict of interest, in particular amongst the increasing engagement of patient groups and similar. Despite the recognition of these gaps and challenges, there were few examples of how to adequately manage conflict of interest, and when we explored the literature, there was even fewer topics that explored conflict of interest in patient-oriented research. Overall, Many gaps existed in relation to how conflict of interest is understood in research and how this can be identified and managed.
In 2021, we hosted a tweet chat to engage the patient-oriented research community in a conversation about conflicts of interest. We prepared by ensuring a dedicated hashtag, resources to orientate the public to the tweet chat, including a video, and ensure there's a dedicated facilitation plan. The tweet chat was an exciting activity. We learned that conflicts of interest were poorly understood and that the language around conflicts of interest were a barrier. Participants identified the need for more resources that support discussion among all team members. To learn more, we undertook interviews with diverse stakeholders engaged in patient-oriented research, including patient partners, people of lived experience, researchers, and knowledge users.
Through our analysis, we learned that overwhelmingly, patient-oriented research was viewed as a mechanism for change. That is, it was seen as an approach that could move the dial and contribute to improved health and health systems. Patient-oriented research was seen as bridging worlds, contributing new and important insights, and changing the way that research is undertaken. Most importantly, participants recognised that patient-oriented research challenged dominant assumptions. Overall, the ability to cement partnerships with patients and the public was seen as a gift and a chance to bring forward topics of relevance to those with lived experience. When speaking about conflict of interest, compensation was a common topic, and participants noted that this was an important and evolving aspect of patient-oriented research. During the interviews, participants recognised that conversations around funding, and in particular research finances, can be quite challenging and somewhat delicate. Overwhelmingly, participants recognised that there should be an expectation of fair compensation for patient partners and community members who are working with research teams. This occurred in recognition of the important and unique insights that patient partners bring. However, participants also recognised that compensation was underpinned by diverse factors and considerations. For some, this included the need to ensure that compensation was appropriate and that this was negotiated with the person in question. This included a recognition of the need to support self-determination and inclusion, including the choice to decline compensation or for participants to seek alternative modes of compensation that best meets their needs. Finally, there was also the recognition that teams must communicate clearly around expectations, particularly around compensation. For one participant, this also included recognising that compensation can change the dynamic of partnerships. They noted, "I struggle with the language and the mindset and the framing of, well, you're doing the work, we need to compensate you. I push back against the notion of capitalism defines work. You also create an employer-employee dynamic." It was clear that compensation is a complex and changeable topic. When asked about conflicts of interest in research, the participants noted that conflicts of interest, either actual or potential, exist in most research spaces, and that it was sometimes difficult to know what might be considered a conflict of interest. Many participants explained how these conflicts can be more than mere financial considerations. For example, one participant explored how they navigated research relationships where dual roles existed. For example, they commented, "We recognise that we are engaging in a research relationship and that we also have a clinical relationship. We agree to navigate this for the success and the safety of the project and its participant. We will always communicate separately about the project and the patient's care." As we can see, conflicts of interest were quite complex in the context of research. Likewise, other participants noted that there was a need to be conscious of our own positions when engaging with others. That is, and need to be reflexive and aware of who I am in this space at this time. Throughout the interviews, the participants recognise the need to continue to work to explore conflict of interest and to develop the tools, policies and resources that will help raise awareness of them. Participants noted in particular the need for flexible policies and procedures that could help teams navigate these challenging issues. In addition, stakeholders recognise the need for tools that could help support conversations with all team members, as well as resources that could help teams engage in conversations and planning around conflicts of interest. For one participant, this could include a little case study that you actually play out, direct acted scenarios. They noted there's nothing better than making a conflict situation real and then working through it and actually seeing if people even recognise what's going on. In addition, there was the recognition of the need to normalise dialogues around conflict of interest, particularly in patient-oriented research, and as patient-oriented research continues to evolve at a rapid rate. In summary, conflicts of interest were seen as an important topic in patient-oriented research today. The final stage of this research comprises a consensus building workshop. Consensus building activities uses various forms of data, including research evidence and experiential knowledge, to generate priorities that can inform practice and policy. During this stage, our team will gather and integrate the data that's been collected through our literature review, our tweet chat, and the interviews. We will develop an evidence summary that will be used as a foundation for our workshop. This will summarise the key messages from each of our previous activities and will ask questions that group members can think through before they attend. During the workshop, we will engage in focused discussions and group activities. In particular, the group will discuss conflict of interest, identify ways to support teams to identify and manage conflicts of interest in research, and then engage in priority setting activities. Our workshop will be held virtually and will last approximately 2 to 2.5 hours in duration. This fast-paced priority setting workshop will generate the gaps and priorities needed to further this work. In particular, it will raise further questions that are relevant to patients and knowledge users, and it will also help understand how conflicts of interest occur in the context of patient-oriented research. The results of these activities then become further compiled to form an action report. This action report can be distributed across the patient-oriented research community and will also help our team to plan our ongoing knowledge translation work. Overall, the consensus building process is an engaged and iterative process, one that will involve diverse stakeholders and will end in the development of practical actions with what we hope will be a high level of utility.
As an ongoing process, our teams are engaging in knowledge translation to raise awareness of conflict of interest in patient-oriented research. This will include developing tools and resources and continuing to generate insights that can advance the science of patient-oriented research. We are excited to be in the process of undertaking tool development, as well as sharing our work through presentations and manuscripts, as well as planned workshops. We thank you for joining us, and we welcome the opportunity for questions and for you to reach out to our team for more information.